Hi everyone, my name is Dr. Michael Wald, the Blood Detective, and here is yet another conversation with a bit of a twist on dementia. This one focused on medications that actually increase your risk of dementia. And in my opinion, dementia at this point worldwide, and certainly at least in the United States, is of epidemic proportions. So who would have thought that the medications we're taking for, legitimate healthcare problems, the right medications for those problems, could actually be stealing our very identities away in terms of promoting dementia. So we're going to talk about that, some of the medications involved, and how they actually can increase your risk of dementia. I am a doctor of chiropractic with a board certification in nutrition. I'm also a dietitian and sports nutritionist with a master's degree in nutrition. I'm also a life coach, and I provide acupuncture to my clients. I did earn my MD diploma, but I do not have an active license to practice medicine. So this conversation is known, I've entitled it, Over-the-Counter Medications That May Raise Your Dementia Risk. So let's get into it. Just realize, though, that this information is not meant as a substitute for sound medical or health advice. It's for your education, so use it wisely. So we're just going to get right into this brief but pointed presentation. These are some of the common medication groups that have been shown in studies to statistically increase risk of dementia. And we know now that the medications that we have of dementia are terrible. They don't work. So we need to mitigate our risk of dementia by knowing about these medications. So for example, anticholinergic medications. They block a neurotransmitter in the brain and body known as acetylcholine. And by doing that, they will impair memory and cause structural changes to the brain. We don't want that. And then we have very common medications in the group of known as proton pump inhibitors. So those are antacids to reduce, reflux symptoms, for example, or gastritis. And they reduce the absorption of B12 and magnesium, which are known to lend themselves to cognitive decline. But proton pump inhibitors basically shut off your stomach acid. And we need stomach acid to absorb and activate many different nutrients, way beyond just the B12 and magnesium I listed here. I'll give you one more example. I'll give you two more examples. So proton pump inhibitors, by shutting off stomach acid, will not allow the calcium in your diet to be ionized, because we need stomach acid to, let's say, this is stomach acid, and this right here is calcium. If we don't have the acid, we cannot activate this. If we have the acid, we can ionize the calcium, so the calcium knows to go in the bones, and some of it's used in the brain. But if we do not have that stomach acid, we will not ionize it. Also, we need stomach acid to properly absorb iron from the diet. So proton pump inhibitors can be the cause of ongoing iron anemia, which can have many different health implications to it. And then there's benzodiazepines. So they disrupt what's known as synaptic plasticity. The structure of the brain it goes from a healthy one to a not so healthy one. And also the benzodiazepines specifically lower what is known as hippocampal activity. That's just an area of the brain that's critical for memory, and it's affected adversely with these benzos. And then there are tricyclic antidepressants. So these are sedative and anticholinergic effects, and they will and are well known to interfere with memory. And if we move along, here are some, I thought it would be valuable to give you some alternatives to these medications, because that's one thing saying that they cause problems, but to leave you with no way out of them, I think would be disingenuous of me. So for what it's worth, these are just some things that I've come up with over the last 33 years or so of my experience in the holistic health field. So with the anticholinergics, we could potentially use, and I'm not telling you to go ahead and stop taking your medication. You do not want to do that unless you speak with your prescribing doctor. And if you do decide to come off of your medications and transition to some of these natural things, you also want to do that with a qualified health professional who has both medical training and nutrition training on a high level. So we can use quercetin and stinging nettles and omega-3 fatty acids, for example. These all support neurotransmitter balance without blocking acetylcholine. And then there's the proton pump inhibitors, which I just talked about, the antacids. So how can we do without those medications? Well, there's a great potential. I've helped many patients get off PPI drugs and have natural alternatives that actually fix the problem. So digestive enzymes will help a person digest better. Also, there's something known as DGL licorice. DGL stands for deglycerinated licorice, which means the glyceritic acid is removed. It's deglycerinated, and that's very good for helping the body form the mucus protective layer in the esophagus and in the stomach, for example. And by doing that, especially in the esophagus, it allows for greater healing. And slippery elm also does something similar to DGL. Chamomile tea also synergistic with DGL and slippery elm. Eating smaller meals will allow for your digestive tract not to be as stressed, so your need for proton pump inhibitors should be far less, to nothing. Sometimes just controlling the size of the meals can readjust someone's digestive tract so they can stop their PPI drugs. And then, of course, identifying and avoiding any trigger foods that would cause reflux, let's say, or hyperacidic conditions for which you were given a proton pump inhibitor drug, but by identifying those foods and avoiding them, you may not need the medication. And for the benzos, there's L-theanine, which is a brain relaxant, and magnesium glycinate, which is well known as a central nervous system relaxant, along with passion flower and valerian root. And then there's CBT1, which helps in mindfulness. All of this helps to calm down the nervous system, so you don't have to rely on these very strong medications with all sorts of side effects. Not to mention, these are all increasing your risk of dementia. And then there are the tricyclic antidepressants. So we can sometimes do without those if we have the proper exercise and sleep, reduce our stress, we learn proper coping mechanisms. We might want to consider the supplement SAMe, which is a methylating nutrient, and methylation is associated with depression. And so I think you get the idea. And again, all of these medications here are known to increase risk of dementia. I've listed more medications. First of all, I did this presentation because there's a trending article on this right now, and it named about 4 medications. So I'm giving you more than twice the number of medications, and I could go on in the dozens upon dozens of medications that can directly or indirectly increase one's risk of dementia. So you may want to look at this a little bit more carefully, but I've given you some extra ones here. So I hope this made a difference for you. In addition, what I tend to do with my persons with early dementia or think that they may develop dementia or are concerned about the possibility of it, we always look at their diets. We optimize their diets based on their various needs and their health goals. When I give them nutritional supplements, I give them the dosages that would help protect the nervous system in ways that the studies show can help offset risk of dementia and, of course, improving overall health. You have to improve overall health because there are many different forms of dementia. So quickly, if there is a vascular issue to the brain, then we might have a vascular dementia. Lack of blood supply to the hippocampus, for example, will affect memory and cognition. Sometimes it's neurologic. It has nothing to do with vascular, where nerves degenerate, let's say, and that might need different nutrition, let's say. And we can go on. There's different types of dementia. So when we give supplementation, when we give foods, they have to match the specific person's needs in that area. Thank you so much for attending this brief, but I hope important presentation meant to have you be aware now, once and for all, that the medications that you're taking may increase your risk of dementia. At the very minimum, speak with your prescribing doctor about going on to alternative medications if not trying some of the natural remedies. Thank you very much, and I'll see you at the next presentation.